Bipolar disorder is a disorder characterized by severe fluctuations in mood, where manic periods alternate with depressive periods. In the last video, which you can find by clicking here above, we have seen in detail what bipolar disorder is, what are the symptoms, and what types exist. What are the causes of bipolar disorder? The causes are currently not fully known, but it seems that at the basis of the genesis of the disease, there are several genetic factors. It is a disorder with a strong genetic component. Those who have relatives with bipolar disorder, especially if a close relative, such as their mother and father, is ill, have a 10 times greater risk of developing the disorder. After some studies conducted on twins, it was discovered that in homozygous twins who share the same DNA, if one of the two is affected by bipolarism, the twin has the probability of 40% of developing the disorder, while for heterozygous twins, the probability drops below 20%. Biological factors. According to some studies, in a person suffering from bipolar disorder, there are alterations in the levels of some neurotransmitters, such as dopamine, serotonin, and noradrenaline, which are important in regulating mood states. Thanks to an international research group called Enigma, several neuroimaging studies have been carried out on patients with bipolar disorder. All this was possible thanks to neurovisualization techniques. Some areas of the brain have thus been identified which seem to be those most responsible for regulating emotions, mood, and energy levels. Other scientific studies, also conducted by Enigma, have shown that patients suffering from bipolarity had reduced brain volumes in the areas of the hippocampus, thalamus, and amygdala, fundamental structures in the emotional control of environmental factors. The environment in which one lives can favor the appearance of symptoms, especially in correspondence with stressful situations, such as abuse during childhood, serious emotional losses, work, or financial problems. All of these events can cause emotional shock and cause predisposed individuals to develop the disorder. The various environmental factors can therefore determine on the subject an imbalance of neurotransmitters within some specific areas of the brain with an alteration in favor of excitatory transmission, hypomanic and manic or inhibitory episodes, depressive episodes. Even strong periods of stress prolonged over time favor the onset of bipolar disorder as they modify the neurochemical functioning of the brain. Some risk factors that can favor the onset of bipolar disorder are drug abuse, such as cocaine and hallucinogens, alcohol abuse, some drug, sedative, anxiolytic, and hypnotic therapies, some autoimmune diseases that interfere with neuronal activity, such as multiple sclerosis. What are the consequences of bipolar disorder? It negatively affects the life of the person suffering from it, ruining his interpersonal relationships, and even causing the loss of work. People with bipolar disorder are approximately 20 times more likely to commit suicide than the general population. As for the Bipolar Disorder Aggression Association, it is more a social stigma than a clinical reality. Episodes of aggression are rare and are often linked to alcohol or drug abuse. Following a research conducted on patients suffering from bipolar disorder at the San Raffaele Hospital in Milan, it emerged that only one patient out of 100 showed aggressive attitudes towards people, while in the other cases, violence towards objects or episodes of verbal violence was recorded. How is bipolar disorder treated? Acting promptly is very important as it improves the prognosis. The therapy to be followed also depends on the type of bipolar disorder diagnosed in the subject and the type of episode in progress: manic, hypomanic, mixed, or depressive. For the treatment of bipolar disorder, it is important to set up a correct drug therapy. The goal is to stabilize mood, reduce the frequency and severity of manic and depressive episodes, and prevent possible relapses. Neuroleptic drugs, mood stabilizers, Antipsychotics and antidepressant drugs during the depressive phase are generally indicated. Drug therapy must be combined with cognitive behavioral therapy, which helps the patient to modify cognitive distortions and those thoughts typical of the disorder. Psychoeducation has also proved very useful, which can be carried out during an individual or group interview and responds to the needs of those who suffer, but also of family members, to learn more about their disorder. Knowing your condition better helps you understand the aspects, as well as your emotional and behavioral reactions. Psychoeducation helps the patient to recognize in advance the initial symptoms of the two phases of bipolarism in order to then be able to contact the psychiatrist and avoid heavy relapses. Thanks to psychoeducation, the patient learns to take care of himself and his disorder. In some cases, however, the treatments described above do not give satisfactory results, and hospitalization is therefore required in order to prevent the patient from putting his own health at risk.